I mean, is it typical if a mom had a low milk supply for their first child, they're going to have it again, or if it's different every time? And should they prepare differently or try something different if that's the case?
Absolutely. So, definitely, again, you would be somebody during pregnancy. I would reach out to a lactation consultant. Maybe you saw them with your first baby and say, "Hey, I'm pregnant again. These are the issues we had with number one. I want to have you readily available to kind of help the process." Also, too, when I'm seeing a patient in the hospital, I kind of get some history. Well, what happened the first time? Was it really you were breastfeeding every 2 to 3 hours and the baby was doing well, but just had a low supply, which is very rare? There has to be something else that's kind of contributing to it. Maybe you had stitches and the stitches weren't healing, or maybe you had retained placenta or some type of blood products that was preventing your milk from fully coming in, or say that you had a baby that had a poor suck reflex and really wasn't feeding well the first couple of days, or you initiated bottles right away and you were skipping feedings at the breast. So kind of really trying to get a history of what happened the first time. What was there anything that sticks out as a lactation consultant that would have hindered milk from coming in from the beginning, and making sure that we kind of nip that in the bud right from the beginning. Okay, well, maybe you initiated bottles right away because you weren't making milk, but actually in return that hindered. So definitely would be somebody that I would make sure that they, had a lactation consultant, speak to them ahead of time and kind of prepare. If you were that one that, no, I was feeding every couple of hours, I was doing everything that I thought I could, and the milk just never came in, absolutely, you're going to be somebody that we're on top of right from the beginning. Did you have breast changes? Are there any medical concerns, maybe medical things that we missed that we're not picking up on? And definitely would be somebody that I would initiate pumping right away. If I have a baby who's not doing a good job, we supplement that with the pumping to make sure that you are still getting adequate stimulation, whether it be manual expression or physically pumping, to help your body the best that we possibly can to get that milk to come in. You would also be somebody that I probably would maybe do some type of galactologs or herbal supplements right from the beginning. If I have followed somebody for their entire breastfeeding experience with baby number one, and I know them and I know that we checked off all those boxes and they're pregnant again, absolutely, there's somebody that right away we're going to be doing a lot of additional interventions just to help facilitate having a different experience this time.
So I actually had someone reach out asking about this today, about a low glandular issue or tissue, and having an issue with milk supply. Is that something that they can go into a lactation consultant and they'd be able to test, or how is that figured out?
It's not really something that we test for. Usually, you can tell physically by looking at a patient where they don't have enough glandular tissue. So during your teen years, when you were starting your menstrual cycle and you were going through some of your female changes, how your breast developed. If you were very athletic, say you were a swimmer or gymnast, you're constantly working out that upper body, and usually they don't have as much breast tissue as, say, maybe somebody who wasn't athletic. When it comes to milk production, people really think that if I have small breasts, I'm going to produce little milk. If I have big breasts, I'm going to produce large quantities. Not necessarily the case. It just has different storage capacity. So if I have somebody who's got smaller breasts, their breasts will probably swell a little bit more, and the baby might want to eat a little bit more frequently because there's just not enough storage capacity to have all of that extra. Okay. But if it's true issue where they did not develop properly, a lot of times they will also have issues with milk production. But again, I could have a mom, a classic case is people that have polycystic ovarian syndrome. We call it PCOS. A lot of times they have classic sign of very little glandular tissue. Their breasts develop very oddly, not necessarily the normal rounded shape like we would, think of if we, looked up breasts, say on the internet or whatever. They're usually very thin and kind of squishy. There's just not a lot there. So that lets me know that there was some type of hormonal response when she was developing. So that can also contribute to milk production. But again, I've had moms that have PCOS that make tons of milk, and then I have moms that have it that make none whatsoever. So everybody is very different. There's a difference within medically that type of scenario than say I was a gymnast, I competitively competed and worked out, and they have small breasts based upon working out and being athletic, versus I didn't develop quite right when I was, developing as a child. One can be more just physical and the other one can be more medically. So we have to kind of look at both of those aspects to determine, in this particular case, which is it.
Okay.
And, definitely would still reach out to a lactation consultant, because again, we want to, those are things that we want to catch early enough and, see, is it medically something that caused it, or is it just how you developed during puberty because you were very active?